I'd like to ask Dr. George your thoughts on what early detection can do.
Yeah, so as others have said, it's really important that we know our family history and know our risk for cancer, for breast cancer specifically. And so some of our work has shown that based on where you're born, in particular, just like the Ashkenazi Jewish population where we know that high rates of hereditary breast cancer, women, some groups from the Caribbean, like the Bahamas, Trinidad, Barbados, and others have high rates of hereditary breast and ovarian cancer syndrome, which means strong family histories, or sometimes that they're not fully aware of the family history. And so knowing your family history, having that conversation with your primary care doctor is going to be so important in terms of early detection and prevention.
Dr. Lewis, your thoughts?
So definitely in regards to all of these elements, as healthcare providers, our goal is also to demystify what elements are important and what is not as distinct. So most individuals are good with passing on information about their family history. However, there's some details about health history is sometimes gray and undiscernible. So the key thing is to talk to earlier generations about breast cancer, talk to individuals about healthcare prevention as a whole, and not wait until it's too late in order to address some of the risk factors and identify that.
Well, to help catch breast cancer early, here are the latest guidelines from the American Cancer Society. For women at average risk, women between 40 and 44 should get a mammogram every year. Women 44 and older can switch to a mammogram every other year, or they can continue to get them every year. Screening should continue as long as a woman is in good health and expected to live at least 10 more years. All women should understand what to expect when getting a mammogram and what the test can and cannot do. And, you know, according to the graphic that we're seeing on our screen, women at high risk for breast cancer based on certain factors should get both a breast MRI and a mammogram every year starting at age 30. The recommendation includes women at an increased lifetime risk according to assessment tools based mainly on family history. Those risk factors include a known BRCA or BRCA1 or BRCA2 gene mutation, a first-degree relative like a parent, brother, sister, or child with a BRCA1 or BRCA2 gene mutation, having radiation therapy to the chest before 30 years old, Lee Frenette, also the Cowden syndrome. Thank you, doctors. Appreciate you. And Banyan-Riley-Ruvalcaba syndrome can be a first-degree relative with those syndromes as well. Either a sister with one of those syndromes can be very telling as well. Some women at very high risk have opted to protect themselves by having preventative surgery to help their breast, and in some cases their ovaries and other parts of their bodies. The CDC calls them previvors. In this conversation recorded as part of the CDC's Bring Your Brave campaign, two women talk about how knowing their risk helped them make difficult decisions to protect their future. Here's their story.
I'm Nakia. I found a lump in my left breast at the age of 30. Had no idea that there was a family history of breast cancer. Just kind of living my life in my 20s, happily, blissfully unaware. And it was a benign tumor, and then found out that I am a carrier for the ATM gene mutation. So I'm a previvor. It's been about 4 years now of monitoring. Every 6 months I go in for imaging.
My name is Diana. I am 26 years old. I am a BRCA2 positive person. I am a previvor, so I found out I was BRCA2 at the age of 22. I was in my senior year of college. I was going to graduate, and then my life flipped, and I was like, okay, wait, what do I want? I have a family history, which is why I took the test, and I went through the double mastectomy and the reconstructive surgery at the age of 23.
I feel a little judged for wanting to get a mastectomy. It's maybe not the obvious choice, but the thing that's hard to explain to someone who hasn't gone through it is every 6 months having to deal with the healthcare system and showing up for a stressful ultrasound and mammogram as one of the youngest people there. And you're just laying there in a cold room, like, is today the day? Do I have cancer? And going through that every 6 months has just been horrible for me personally. Just the fear and the not knowing, and then how is my life gonna change, and just feeling like I don't have control.
I'm in my mid-20s, trying to explain this to a mid-20-year-old guy. It's hard to explain, I have this and I'm gonna carry this with me. But I haven't had cancer, but I might get cancer, but I had the surgery, so I don't have cancer. But then there's other risk factors, but then there's like, I wanna have kids, but then they might get the mutation. Like, it's such a weird position to be in, kind of like, do I wanna be vulnerable, do I not? Like, does it worth it sometimes at this point?
Like, I could count on one hand the people that knew what was going on. And it was just because I felt as a pre-viver, like I shouldn't be taking up space or talking about this because I don't have cancer. And all of the things I'm thinking about getting a mastectomy would be preventative. And I'm so lucky to even have that choice. And so I've just been very timid to like share my story. And then I feel guilty for not sharing because it's like, this is my story and it could help somebody else. So I'm like, I feel guilty either way.
When I look at you two in particular, I look at this could be my daughter. After we found out that I had BRCA2, if it came down to it, there's a chance that I could have passed this on to her. But knowing that I can have her watch this and I can say, look, they did something before they got sick to advocate for themselves. That's what you did.